Hey, Maureen, karibu sana to the Prudentials. Paul Karashia, karibu sana. Rhoda, I see you. Let me invite Rhoda. Today I have Dr. Rhoda Ojwang. So let me invite her.
Hi.
Hey girl, what's up?
What's up, Georgie? What's up, man?
What's up? I'm good. Niaze ikoaze. Miuka Kamau, karibu. You good?
I'm good. Thanks for...
That's good. Yeah, asante sana. San Diego kukoaje?
Iko poa, mazee weather ni poa. Beautiful San Diego.
Oh my goodness. It was like freezing here. It was like 40 degrees this morning. It was crazy when I was getting off from work.
Really?
Yes.
I came
Yeah.
to the pool.
Yeah. Yeah. Karibuni guys. Yeah. So let's hang around maybe like one more minute so we can get people to come in here.
Hi, Nancy Obala. Hi, Pasi Chinta. Nancy Wasolo. Those are my girls.
Huh? You can say shout out. Yeah.
Okay. Oh, shout outs are allowed. Okay.
Yes. Keep doing shout out. Beatrice Wambui Juguna. Yeah. Asante sana to join the Prudentials.
Hey, Beatrice. Yeah. Thanks for coming in. Hey, Nancy Wasolo, all the way from Seattle.
Yeah. Gitao, that's my co-founder from Seattle, Washington. God. Yeah.
Gitao guy, I know him from way back.
I know. Gitao, share the video. Nancy Obala.
Hey, Nancy.
Karibu.
Hey,
yes. Join in, guys. Join in. Yeah, fit sana Martin Nyamuti. Yeah.
Oh, that's my guy.
Benikamuru. Keep saying shout outs, Rhoda. Shout out, yeah.
Martin Nyamuti, all the way from LA. Someone invite Miriam Jeru, please. That's my girl.
That's good. Millie Ogum. Did you know, actually, I went to school with Millie Ogum.
That's my cousin.
High school. Yes.
Oh my God.
We finished the same year. Yeah.
Oh, wow.
Yes.
Oh my God. It's such a small
and she told me
world.
she's your cousin. I was like, what? Yeah.
Yeah.
Me and Millie, we go way back. Over maybe, I don't want to say the age, but over some few decades ago.
Okay. Good stuff. Good stuff. Oh, Gitao, thanks so much. Thanks for the shout out. Yes, Karumudan coming in.
Yeah, Karibuni guys. Yeah. This is gonna be great. I think we have good forum now. We can get started. What do you think?
I see 34 people on. Yeah, we can get started, Georgie.
Okay. Yeah. Keep share the video. Invite a friend. Tag a friend. Because this is gonna be a good show. I have Rhoda here. She's a doctor. She's based in San Diego. So the first thing I want to do, Rhoda, is I'll have you introduce yourself to the viewers. Tell us who you are, where are you from, and your titles, anything. Just tell the viewers who you are, please.
Okay, thank you so much, Gigi, for the forum. I want to just start by apologizing. I know you've been asking me to come to the show for a while now.
Yes.
It's been busy, but you know what? I made time for you, so today I'm here. Thank you so much for having me. Okay. I am going to introduce myself. For those who don't know me, I am Dr. Rhoda Ojwang. I am a DNP, and I'm also a certified family nurse practitioner in the states of California and Washington. I know when I say Ojwang, people kind of roll their eyes. It's like, it's Ojwang, actually. But, I just give it a little wang.
Hope you're not going to get so much hate today.
I know. Jalua in the house. Anyway, let me not go there. Yeah, so you guys, I live in San Diego, California, and that is where I practice as a nurse practitioner. I am from Kenya. I was born in Nyeri, and I grew up in Kitale.
Nyeri? Hey, hold on. Nyeri?
Yes, I was born in Nyeri. I was born in Mount Kenya Hospital. My dad is an ENT doctor, and he used to work there. So that's where I was born, and I lived there for a few years before my parents moved to Kitale. So
that's good.
yes.
All righty. So what do you do there? Do you work with, how kind of patients do you take care of?
Okay, so right now I am in family practice, and mainly I do like chronic disease management. So we're talking about diabetes, high blood pressure, thyroid conditions, among others. And I also see a few women's health cases like STDs. I do a lot of contraception, oral contraception care, stuff like that. But mainly it's family practice. And go ahead.
That's good. Before we go on, Rhoda, because I think we're going to be discussing about the medical stuff here, the health stuff. So is it okay if I give a disclaimer? Because the social media, the way it is right now, I think it's always good to give a disclaimer there for somebody who might be watching this. They don't want to say, oh, I saw these on Georgie and Rhoda here, and I went to, CVS and I bought these, and they say, okay, you can go ahead and use it. So for the sake of me and you, to cover ourselves, I'm going to read a disclaimer here. So these broadcasts provide general information and discussion about health and related subjects. These broadcasts should not be construed as medical advice. If you have any medical problem, seek medical help from your primary care providers. So that's the disclaimer right there. So we can go ahead and get started now without, any, yeah. So the first question I was going to ask you, Rhoda, tell us, because I know you have these organization you started about, is it 2 months ago, Howie? Tell us what is Howie, what is it, and what is the mission statement for your foundation that you just co-founded?
Okay. So a few months ago, well, a couple of months ago, Fancy Faith and I got together, and initially it was her idea. Fancy Faith is a friend of mine that I have known for over 10 years, and we met in Memphis, Tennessee, and I'll talk about that later, how we met. So she brought the idea to me, and we started talking about it, and we just decided that this is something we were gonna initiate, because we do realize that access to healthcare is a big issue, not just here. And our target was mainly in Kenya. And the name of this organization is Healthcare Access Worldwide, Inc. That's the abbreviation HOWI. And our mission statement is to make healthcare accessible among our underserved population. So we are looking at Kenya and Africa, and of course, eventually worldwide, because we cannot make this thing worldwide and we haven't done anything at home. So, charity begins at home. So that's why we are currently working to make healthcare accessible. And how are we going to do that? So right now we are looking at the use of medical missions, making these medical missions known. We want this to be a platform where people can come and announce the medical missions to certain areas so that people can know about them. Providers in the area can come out and help out. And apart from that, we're also making healthcare accessible through this forum where people can come and ask questions. And again, we do have a disclaimer that this information that is going to be available here is not meant to treat any medical conditions. We still really encourage that patient-provider interaction. So we don't want people coming on here and posting a question and then using that to treat. Yes, they can use that for information purposes, but they also need to go and be seen by a doctor or any other healthcare practitioner out there. And another thing too that we are looking at, and like you said, Howie is still very young. This is our baby, and we have a lot of plans going forward. Again, technology is here, and we want to utilize this technology to make healthcare accessible. We are looking at down the line, maybe having some kind of app where we can get access to those patients, and you can interact with a provider and get medical attention or get medical advice. And again, I know it's going to take a while for us to get there, but those are things that we have talked about, and we are trying to find ways to make those accessible, or at least rolling. So
yeah, I joined this group. It's a great initiative, and I think if you want to tell the people how to join this group and how many members do you have so far? How many people have joined the group?
so far we have about 9,500 members as of this morning.
Mm-hmm.
It is a group that's open to the public, so anybody can join. We want people to join from all over, and we have people from Kenya and other African countries. We also have people from the USA. If you know of anybody that can benefit from this group, add them to the group. And like I said, it's an open group. It's open to the public. If there's anything in that group, a video that you feel you want to share, we allow sharing of videos to other, or just posts, to your personal wall, or to your personal page, or anything, anywhere else you want to share it to. And something else I was going to say, it's Healthcare Access Worldwide Inc. So if you type those words on your search box, then you should be able to find it, and then just ask to join, and one of the administrators or moderators will let you in, or a friend can add you into the group. So
yeah, so if I get you right, so this group, you don't have to be a nurse or a doctor or a respiratory therapist. It can be anybody. Is that right, or just?
Very right.
Okay.
As much as we want a lot of providers in the group, healthcare practitioners, we also want people who are not in the healthcare field, and we have IT people, we have all kinds of people, anybody, because guess what? Healthcare affects us all, whether you are in the medical field or not. So you guys feel free to invite anybody and everybody. So long as you're alive, health affects you.
Yeah, and I want to say it's a good group. I have learned a lot of stuff from there. I have seen people posting like medical stuff. I'm in the healthcare field myself. I'm a respiratory therapist, and I do post some of the stuff there on that website. But I gotta tell you, like for the last maybe 3-4 weeks, I have learned a lot. So I'll ask you to join the group. It's a really good group, and you're going to be benefit from that group. Maybe, Rhoda, you can tell us some of the objectives you're looking so far, you and Faith. What are some of the objectives are you looking for this group?
Like I mentioned, just trying to make healthcare accessible. Like right now, as we speak, there's a Dr. Gasheri that's going to be doing a medical mission in somewhere in Chuka. So then he has posted, and we encouraging providers in that area to help support this mission. It's going to be a free mission for everybody. And if you know of anybody that can benefit from that mission, send them there. So you see, that's one of our objectives, making healthcare accessible. And for us, by us posting on this forum, it's allowing other people to see that can benefit or help with this project. Another thing that we do and we will be doing is helping financially, like donations towards these medical missions. And we will be doing that with Dr. Gasheri and everybody else that's going to be doing medical missions. And it doesn't have to be in Kenya. It could be in, anywhere else, because we do have a lot of providers in this group that are going to other places, not just in Kenya. So, and another thing, apart from that, sharing of this information, or someone who's out there in the village, they have access to a phone, if they can log in and read about these things, or ask a question that can help them or direct them. Because sometimes we do have questions about, I'm in this area and I'm looking for cardiologists or a dermatologist in this area. Anybody knows anything about it? And then a lot of providers usually chime in and direct those people to the right places. So I think, so far so good. I love what's going on. And thank you all for being members. Georgie, thank you so much for you're always very active in the group. Mm-hmm. I know today there's a little situation, but
yes. Oh my God, yeah. Mm-hmm. And that is expected in any social media forum. That is expected. So
yes,
I'm good. Yeah, so I'm good with that. Yeah. The other thing I was going to ask you, Dr. Ojwang, is since now you're a doctor, you have formed this initiative for this group. Can you tell us some of the ways you can be able to promote the health and wellness in our community, especially in the diaspora community?
Okay, that's a very good question. Apart from the diaspora community, I will come back and answer that. Just in my community, I do a lot of health fairs. I am part of a lot of health fairs in my community. I go into the schools, like high schools, and I do teach about sex education, the importance of college, you know, just to encourage our young ones or our young, I don't have any young ones, but, you know, just to encourage our high school children to, you know, to be safe as far as, you know, drugs, talk about drugs, talk about sex, safe sex, topics that they can benefit from. Also, we are going to be starting, this is not out there yet, but I'm just going to talk about it since you asked. We're going to be doing like health fairs that we're going to be setting up for a diaspora community. And this is going to be happening in LA area. And it's going to be like a once a year event where we just pick a weekend and we do like a full health fair. There's like blood sugar checks, blood pressure monitoring, heights, weights. We talk about, you know, preventative measures, lifestyle modification measures. So I think that will really benefit our diaspora community and, you know, going forward. So this is something that's in the making right now, and it will be rolling very, very soon. So you guys stay tuned.
Yeah, thank you so much. And I think we can have more people like you who is giving back to the community. And we appreciate you for coming with this beautiful and good forum. Let's move on. The other thing we're going to talk about here, me and Dr. Rhoda, is when you went to school for your doctorate, I did look. And one of the things that came up when I was trying to research you, it was a dissertation that you did. Can you tell us, maybe to the viewers, what is a dissertation first? And then you can tell us what it is that you researched in your doctorate program.
Okay, thank you. A dissertation is a project that you take up when you're doing your doctoral studies, and you study to do a lot of research on. It's called a dissertation doing a doctoral program, and it's called a thesis if you're doing a PhD. So my topic was addressing depression among African immigrant women in the United States. And the reason why I chose depression is because as an RN, I worked in so many areas. I did NICU, I did emergency room, I did psych, chemical dependency. So depression is something that mental health is something that I really loved. And women are more prone to depression than men. And this is across the board, not just among our African community, even among the Caucasian and any of the groups. So I thought that would be something that I would really love to research, because I really did spend a lot of time researching that. So that's what I chose, and I had a lot of fun doing it. And I was able to work with a focus group that was here in San Diego in a refugee camp. I really never worked with anybody from Kenya. It was mainly women from Ethiopia, Somalia, Eritrea, and Sudan.
Yeah. When you say working, were you conducting any survey, or how did you do it when you are doing your research? Were you interviewing these people? Were you following them from their day-to-day life? If you can expound on that.
Actually, as far as that is concerned, I didn't do like a survey, like an individual survey for them. I had a focus group. And the way my project was, I just had to interview them and get to hear, what their side of the story was as far as depression, or if they even knew anything about depression. And then what I found out was there was a lot of misconceptions about depression. So then my job there was to come in and educate them, create awareness that depression is not a myth. Depression is a medical condition that needs to be treated. And I did find that about 80% of that population did have depression, at least the focus that I had, and I had them directed to a provider who was able to treat them. So
yeah, and what can you say was a triggering factor for the women who are migrating from Africa to US? What is it that they are facing all these challenges, and especially depression?
For most of them, they came here as refugees. So, having to just leave your country because there was war. And then they were separated. Other people, some of the family members went to other camps, and they were, that separation just caused a lot of hopelessness. And then they were promised all these things. When you get to the US, you're going to get a job. But then when they came here, then that's not, they didn't get what they were promised. And then some of these people had really good jobs, like back home. And then they get here, then they don't have a job, or they have to start from scratch. So of course that will cause depression, financial issues. Maybe some of them didn't have enough money, or they had jobs that were not paying them as much as they had back home. Being held in refugee camps for a prolonged period of time with very limited resources. That's another issue that was causing depression. Domestic violence was big among these women. And then they, for fear of being, maybe their spouse being arrested and charged, then they would just suffer silently. And that will cause, stress and, eventually cause depression. So there was a lot of issues, that these women were going through. Male dominance is another issue that we see a lot among in our community. And, when I say male dominance, sometimes, some people don't take it very well, especially the men. So I'm just going to leave that at that.
Yeah. And would you say the depression, according to your own research or the thesis that you did, is the depression like kind of 50-50 between the men and the women from migrating from Africa? Or would you say it's more higher, on the women? If you can expand on that, or if you can tell us about your finding about the depression among the immigrants.
I still believe that it's more common among women. Women are at least like twice more prone to depression than men. And another thing, maybe, and those studies, show hormonal factors play a role in that. And then women are more likely to talk about their feelings than men. You know what I mean? So I'm not saying men don't get depressed, because when I share with people about what I did for my doctoral studies, they always tend to, I've been called a feminist. Men do get depressed, but women are still more prone to depression than men because of, during pregnancy, childbirth, menopause, like, the hormonal up and down. And then as women, we, there's that, there's a lot that's expected of us in the society. So, let's say I have children, I have to work outside the home, and I'm expected to come home and cook. So I still believe that women have more responsibilities. And again, I'm not saying men don't have responsibilities. Every time I've spoken about this, some of the men have come after me, and that's not what I'm saying. Women are still more prone to depression than men. So, chances that a man is going to go out there and seek treatment is very, it's very slim. But a woman will probably not even seek treatment, but at least talk about it and just talk to a friend about it and say, this is what I'm going through, and I'm feeling a little low and depressed and, very, very sad, than a man, what men.
Yeah, and since you say that, what are some of the signs and symptoms we can watch? Maybe you have a friend that just came from Kenya, Ethiopia, Rwanda, or whatever. What are some of the signs and symptoms you can watch for these depression? Maybe if you see what they are doing, maybe you can be able to help them and recommend them to go to the physician.
Okay, so like feeling like really sad, persistent feeling of just loss of energy, loss of interest in the things you like to do, lack of sleep, or sometimes some people sleep a lot. Some people will gain weight, some people will not, will lose weight. And then some people will talk about suicide. So I'm not saying, like what I just mentioned, we all go through that. And you have to have at least 5 of these symptoms going on within a period of at least 2 weeks. So it's not, if you just have one symptom, if I feel sad today, I'm not depressed. If I can't sleep today or the whole week I haven't slept well, I'm not depressed. like there has to be at least 5 of those symptoms, like I say, hopelessness, helplessness, lack of interest in the things you like to do, sleep issues, appetite issues. Some people will verbalize things about suicide. Then those are things that you definitely have to watch out for and send them to the right people that can get them help.
Do you think is underdiagnosed depression among our community?
Oh, yes. I think depression is, there's a lot of undiagnosed depression, and there's also a lot of undertreated depression. You know, the social stigma, and that's what's killing us. You know, people don't believe depression exists. You know, I've talked to people about depression, and some people have just told me, you know, oh, you too, we've been in this country for a long time. There's no such thing. This is a white man's disease. Africans don't get depressed. You know, so people will say things like that, but then you will see the signs. And some people believe that if I'm depressed or I'm feeling very sad, I'm just going to go to my pastor and he will pray for me and I'll be okay. And I'm going to say today that no. Yes, there are studies to say that people who have a religious belief will do better with depression treatment, but that is not the treatment for depression. You need treatment. You need medication or psychotherapy to treat, and then you can do those other things along with that. But spiritual care or being a Christian does not treat depression. Again, I know I may get dinged for that, but that's okay.
Yeah, and prevention. You know, we hear the community is becoming bigger. We have the pressure for the children, school, work. So, what are the preventions you can talk about preventing the depression among, you know, again, people from coming from, you know, Kenya, wherever they are from, migrating to this country? If you can talk about that, please.
Yes, and as far as prevention, I think people should find a work, you know, balance between work and family. And I know sometimes it can be hard. You have a family, you need to work that 2 or 3 jobs to support. No matter how hard it is, I suggest people find a support system. Be part of a church, you know, be part of a community organization or something, because I spoke about this in my previous live video. Sometimes people tend to keep to themselves a lot. I know there's always a lot of drama with our community, and sometimes people just want to keep to themselves. But there's a lot of studies showing that people who are loners tend to be schizophrenic, and chances that you can do something or commit suicide if you're a loner are higher than when you are someone who, you know, gets out there and interacts with people. So number 1, have a good support system. Just always make sure you have some kind of balance between work and family life. And, you know, like a weekend like this, do something fun. Just, you know, go out there and just do something fun to help, you know, just kind of refresh you from the normal Monday through Friday kind of schedule. You know, find hobbies that you like doing. You know, find a group of hikers in your area if you like hiking, and then just go hiking with them a couple of times a week. You know, just find events in your community that you like doing. Do not suffer alone. Do not just stay home, because this country can get very, very, very depressing. So you guys, I'm just urging you all to do that, because and then another thing, as far as prevention is concerned, I came into this country as a student, as an F1 student, and then I came, you know, so I know the challenges as an immigrant. You know, sometimes you feel like you don't fit in, you know. So then find people that are like you, find other immigrants like that you can associate with, and then expand your circle from there. You know, for me, that helped me a lot. But, you know, I came here, my sisters were here. So it was easier for me to just, you know, get into, you know, mingle with their friends. And I found my own friends through them. So those kind of stuff really help.
Yeah, let's talk about the treatments of these depression. I have heard like conflicting stories or theories out there. Which one is, if you can talk about the treatments, and then you can maybe compare and contrast which is better, whether it's pharmacotherapy or psychotherapy?
You know, and that's that's going to vary from case to case, because when you come in to the office and, you say you're feeling sad or you think you may be depressed, you do fill out a questionnaire, and it asks you questions, and there's like different numbers that you're going to pick. So based on that number is what's going to determine treatment. Some people have depression maybe due to loss, just something going on. Maybe they're going through a divorce. So it's situational. And some people have depression because maybe they're just up and down, they're not taking their medications or for whatever reason. So this is what I can say. If you have depression, you need treatment. And a lot of people don't want to take medications because they think that it's going to alter their brains, or they may not be able to get off the medication. I have patients who have taken antidepressants and gotten off those medications. I have some that I have to keep them on it, a maintenance dose, because then, every time I try they want to get off the medication and I wean them off completely, then they relapse. So that's another thing that we have to watch out for. So I'm not saying everybody that's depressed needs medication. It depends on the degree of your depression. But the way some people have done very well with therapy, just therapy by itself, and they have done well. But if you do medication and therapy, they work very well together. So I would encourage anybody that's depressed, do both of them together. Unless you just don't want to take medication, then try the therapy first and see how it works, and then go from there. But don't just say, I don't think I want to treat this. I don't believe in depression, so I'm not going to do anything about it. At least get on some kind of treatment, even if it's just the therapy, and then get reevaluated and see how it's working. I've had to talk to a lot of girls that I know, and they ask me about this medication, and some of them have done good with the therapy, and some of them have done good with both, and they have thanked me after, because I think there's that misconception that once you take that medication, then you have to take it for the rest of your life. No, you don't have to.
Oh, okay. And that's a very good points, Rhoda. And I have some people saying the more they talk about it, the better. And I think when you talk about something, it eases you off. So that's good. And maybe hopefully this can be a conversation starter. We can engage in these conversations and talk about it, and we may never know, we can help some people. The next topic we're going to talk about is, and the reason I'm talking about this is about the DNP. I know maybe some people they are watching here, maybe they are looking forward to do their doctoral program in nursing. Can you give us some of the tips if somebody is preparing? Maybe somebody is a nurse practitioner there, maybe somebody is a BSN there, bachelor, of a nurse. What are some of the tips you can tell people who are maybe looking to do the DNP program?
Okay, these are my tips. So if you're a BSN, just know what it is that you want to do with your DNP. And some people will get into, they want to do the nurse practitioner program. Do you want to be, if you've been in PEDS all your life as an RN, then you probably just want to go into PEDS and just become a pediatric nurse practitioner. If you've been in psych, then most people just want to stay with psych and just focus on that area. I did the family, just to go back a little bit, when I did my master's. I went into family because even though I had worked in all these areas, psych, NICU, adult ICU, emergency, I just wanted to do family because I felt it was more broad. I can bounce back and forth and change, the type of population that I was working with. But if you decide today, this is what you want to do, just know exactly what it is you want to do, because sometimes people don't know. Or maybe you want to go into, you do want to do your master's and do informatics. Like, not everybody has to be an NP. Just know exactly what you want to do. Some people want to do like public health, then go get a master's in public health. For me, the reason why I did my DNP, because I went into my master's and became a nurse practitioner before I went again back to school and became a DNP. I wanted to get into like executive management type of position. And that's what I'm working on now to, get that done with school, and I can just focus on doing that. And when I talk about executive management, I'm talking about like working as a chief nurse, executive officer, or director of, you know, medical services or something like that. So that's the reason for me. That's my reason why I decided to do my DNP, because the DNP focuses on, it's more clinical compared to the PhD, which is more research, you know, oriented. The DNP is more like a clinical leadership type of stuff. So there's a lot of classes on leadership and management, policies and procedures. There was some epidemiology classes, but yeah, there was more leadership classes, and I believe I am a leader. So.
Oh, okay. And maybe that's why I was coming to the next point. What are some of the qualities somebody must have if you're looking to go for the DMP? Because I know some people, they are very good at bedside, and maybe they might do this DMP and they find themselves in a very tight position. They don't have good leadership skills. Is some of the qualities, if you can talk about for somebody who is looking to pursue a DMP program?
And you know, just because I talk about leadership, and you know, you don't necessarily have to go into that. And I have some friends who've gone into like policies and procedures, or like disease management, or you know, you don't necessarily have to go into or you can do research. You know, there's other things that you can do with the DNP. Yes, we cannot all be leaders. Some people are horrible leaders.
Yep.
You can have NP and just be horrible, you know, be a horrible leader. It doesn't mean that just because you went to school, you're not going to be that great of a leader. So there's other ways. You can also teach. There's a lot of people that did the DNP and now they're teaching. You know, a good friend of mine just landed into a position where she's a dean. So there's that, as you know, but that's more of a leadership position. But you can just be faculty and just teach. So there's plenty of other things that you can do, or you can just be, you know, stay in clinicals and just see patients, you know. So there's other avenues to go, not just the leadership.
So I might not be very sure about this, but I now know most of the nurse practitioners out there, you have to have a doctorate. And if you have masters right now, how long does it take you to become a DMP?
Actually, you don't have to have a doctorate to be a nurse practitioner. It is a master's program.
Okay.
And years ago, there's this thing that came up, and they were saying that, you know, in 2015, this was like, I think in 2012 and 2015, all this is going to be a doctorate program. Doctorate. Pharmacy, now you have to do a PharmD. And I don't know what happened to that. So anyway, the ones that were nurse practitioners with their masters were just going to be grandfathered. But the ones that were coming in will have to go and get their doctorate. But you don't have to be have a doctorate to be a nurse practitioner. You can still just have your masters and be a nurse practitioner. For me, I just had to go that extra step because I wanted to step into a higher or executive management role. So that's why I did it. You know, but right now I'm in clinic, I see my patients, and, you know, as a nurse practitioner, you're able to prescribe, diagnose, you know, and all the above. So.
And how long is the program for the doctorate if you have masters?
For me, okay, you asked me that question. Sorry, I didn't answer it. It took me 2 years to do my doctorate with the masters when I had my masters. Yeah. It took me.
Oh, okay. Wow. So it's 2 years. So that's pretty good. Any good schools you can recommend out there? Like if you live in California, a good school. Did you go to school in California?
No,
for your DMP?
No, I didn't go to school in California. I went to Frontier Nursing University. It was in Kentucky, and that was a very accelerated program. You can do it slowly, and it's going to take you a long time. But I wanted to just get it done, so that's why I did it really fast. Frontier Nursing University is good. I did my master's in Azusa Pacific University in Azusa. That's in Los Angeles County. That's also a very good school. It's a private school, so it can be, you know, a little expensive unless you have a scholarship or something. For most of my education, I had scholarships because, you know, I was a very good student. I am not bragging.
You're not like A student. You're getting it, right?
Yes.
Oh my goodness, yeah.
a lot of people tell me, oh my God, you must have like over 100,000 or 200,000 worth of loans. And I'm like, honey, this
you don't have any.
here is sharp, honey.
Yeah,
so
it works for you.
I kept getting scholarship thrown.
It is working for you. Yeah. Oh, that's good. And what are the challenges of becoming a DMP, if there's any? You know, you finish your program, your DMP here. Is there any point you feel like, what am I going to do with it? Like, oh my God, like, any challenges you want to talk about?
Yes, there are challenges, even while you're doing it, you know, as far as just, you know, it was intense. And it got to a point I felt like, why am I doing this? I can work as a nurse practitioner and retire with this job. This is crazy. There was a lot of research involved, but you know what? I'm glad I kept doing it because I believe that I am a better provider. It really didn't teach me a lot of like clinical skills, but just, you know, getting into that whole research thing, evidence-based practice. Now, if I read something, I want the current research, you know, I want to read up about it and know about it. And again, the leadership aspect of it, it just challenged me to now really just go out there and find that leadership, like I said, executive leadership position that I've always wanted, because that's where I've always seen myself. I've always seen myself as a leader. So those are the challenges. There was a lot of hours put in for research and all that. As far as now, the challenges, there's that challenge that sometimes my colleagues maybe feel threatened because now I have the doctor title versus...
Yes. I see that a lot. Yes.
Yes. Yes. And this comes from this thing that we always say, you're a respiratory therapist. You probably heard this. Nurses eat their young ones. Oh my God.
Yes.
Yes, it is so true. It is real. So, you know, even your own nurse practitioners will not support you. They have if the doctors will call you a doctor, but the other nurse practitioners just, they feel like, why would I do a DMP? That's a waste of my time.
Yeah.
So then you deal with those kind of challenges. And this is how I introduce myself when I go into a patient's room. I say, okay, for my patients who know me, I don't have to introduce myself. They know me. But if I'm seeing a new patient, I go in and I say, hi, I am Dr. Ojwang. I am a DNP and I will be seeing you today. So I am not misrepresenting myself. I am not a medical doctor in any shape or form, but I am a DNP and I am going to use that doctor title because I earned it.
You earned it. You got to use it. Yeah, that's true. Yeah. Our last topic here, you have something you do on the side. You are the skincare consultant. If you can tell us about that, and then I have a few questions I'm going to ask you about after you do the introduction about the skincare, the products.
Okay. Yes, I am a Rhoda field skincare consultant. I've been doing this for about a year, a little bit over a year now. For those who don't know about the company, these are the makers of Proactive. Dr. Katie Rhoda and Dr. Kathy Fields, they used to own Proactive, and they sold Proactive to a different company. So now they have new products for acne, anti-aging, big on anti-aging. This is the #1 anti-aging skincare brand in the US. So usually this is how this works. These products used to be in stores like Macy's, high-end stores, you know, like Macy's, Nordstrom's. And then the doctors realized that their products were selling not because they were in those high-end stores. They were selling because of word of mouth. Like, I'm using the products, I tell Georgie tells his wife, and then that's how people were buying the products. So then they decided to pull the products off the shelves and utilize direct sale. So you have to be a consultant to do this. So I am a consultant. If someone has a skin concern, they reach out to me. I do one-on-one consultations. It's usually free to help determine what product that you want. And then I don't carry any inventory. So if today we do a consultation, you have acne, and sometimes I do video calls so I can see people's face and, you know, skin, or they can just send me a picture of their faces without makeup. And then I recommend something. They go into my website, they order, and the products get shipped from the warehouse, which is in Dallas, Texas, to their home. So that's something that I do on the side. I've always had a passion for skincare. I'm not bragging, but I think my skin looks really good.
Teddy girl.
Oh, God. Yes. Yes, because guess what?
Yeah.
You cannot sell skincare if your skin looks like a frog. Okay, I take that back. If your skin looks bad, maybe saying looking like a frog is not a good word. Yeah.
Yeah.
Because people would say, people will say, if you're using those products, why is it not working for you? So, so you guys, I'm going to say it here.
Yeah.
I'm not recruiting Joji. I'm just going to say that anybody has any skin issues, reach out to me and we'll do a consultation.
Yeah, and you have DNP. You have been involved in research. Is there any evidence-based research carried on this product you're selling? Do you even know what is contained in these products? Do you even go an extra mile and say, okay, this product have this and this ingredient before you prescribe to your patients? Because you have seen people putting mercury on their face, and maybe 2-3 weeks later, they look like, oh my God, like, so what are some of the stuff you can tell us about the product you're selling, whether they're backed up by any evidence-based research?
Okay. Number one, these products were created by 2 Stanford-trained dermatologists. That is enough. So, and these dermatologists are still in practice as we speak. So that tells you something. They are dermatologists. It's not just some company out there just making products. And these products are also clinically tested. And again, clinically tested does not mean it's going to work for everybody. There are some people who will have reactions. Like, for example, the acne one has sulfur. If you have a reaction or an allergy to sulfur, usually you don't do well with that. So in my consultation, I will say, Joji, are you allergic to any medications? And when you say sulfur, then I already know that that is not what you can use. So I ask all these questions to determine. So the products are clinically tested, and the fact that they were created by dermatologists, that's what they do. That's what they do every day, So I have no doubt that the products work because I use the products myself. I can't be selling something that I don't know or I don't like or doesn't work for me. So.
Okay, and I don't know whether you can stress this enough. Can you tell those people who are using the black market products? There are some product out there, they are teratogenic, if that's the word to use. They can cause, if you're pregnant, you can miscarriage. Can you talk about that too? Because I know there's some product there, the skincare product. If you're pregnant, if you put it, you're gonna end up losing your baby.
Yes, and that's why, it goes back to knowing what you're putting in your face. Our products, when you go into my website, there's ingredients of each product. So you can look it up, or if you're not sure, just print that little section out and take it to your doctor, especially if you're trying to get pregnant and, usually stuff like that. But our products are good. You can use it even if you're pregnant. Yes, I do know of products that can be teratogenic. Please, before you buy any products from anybody, ask or read, look at the ingredients and read, or just take it to your doctor if you just don't know anything about these products and ingredients. Take it to your doctor and or call someone. Usually I'm really good at knowing what's in a product. When someone calls me, I can be like, yeah, this is good, or this is going to bleach your face. And bleaching also, let me just talk about bleaching. It's not necessarily a bad thing depending on what it is. So look, some people like this, black market stuff. They're mixing and mixing, and they don't even know what they're mixing. And then you end up having some kind of, your face is lighter than your neck, and you look crazy. So get products that are clinically tested and talk to a consultant like me to help you.
Okay, and good thing you mentioned about bleaching. Is it something you recommend? Because I have seen most of our Nigerian sisters, they're like really light, and maybe the hands are like really dark. And is it even worth it to bleach? People bleach their faces.
Okay, this is what I'm going to say. And again, I get a lot of backlash when I talk about this topic. I do sell some products that will lighten. Let me use the word lighten. Sometimes when women use a lot of, use birth control pills, of course, over time, then they will have like some deep hyperpigmentation issues with their skin. Or sometimes people have like, there's this thing called melasma, when a woman is pregnant, the hormonal thing just, can make her have that hyperpigmentation issue too. So in that case, I will usually recommend a brightening, something to brighten their face, to just kind of help to even out their skin tone. But sometimes you use those brightening agents and it doesn't work. So then I say, okay, I am going to put you on a lightening treatment. It does have hydroquinone and is a 2% dose. Hydroquinone 2% is over the counter. When you go to a dermatologist, they'll give you 4%. So then that's a higher dose. So then I'll encourage these clients to use that, but then I will not keep them on that product. As soon as the face starts to even out, then I put them on something else, because there's, hydroquinone it's been linked to cancer, yes, but then it's not something you want to use for a prolonged period of time. And I've said this in other forums. Today, if I feel like my face is a little dark and I want to lighten, I am going to lighten it. If I want to be like Vera Siddiqa, I'm just going to do it. But guess what? I will do it the right way. I'm not just going to go and get some Korogo somewhere and put it on my face. I will contact a dermatologist and I will do it. Sometimes people feel like when people are using those lightening products, they have some self-esteem issues. Not necessarily. I may just have decided that I want to be a little lighter for whatever reasons. It's just the way women decide, oh, I want bigger boobs. Or I want, I want to make them smaller. I want a tummy tuck. I want a, butt implant. How is that any different?
So according to your own research,
yes.
Do you think that lighter skin or putting these bleaching product, does it raise self-esteem, if any?
Well, that's very subjective. It depends on a person. If I look at myself today and I feel like I'm beautiful, I don't need to do anything to change the color of my skin, then good. But if I look at myself and feel like maybe I'll be more beautiful if I'm a couple shades lighter.
Lighter, yeah.
Then just, that's just how you feel. And maybe who knows why you feel that way. Maybe you just feel less beautiful for whatever reasons. You have some underlying issues that you're dealing with, but that's not necessarily a bad thing. Just go ahead and do it.
Okay, the other thing I was going to ask you is about the oily skin. And I know I have an oily skin myself. What are the products out there? Is there any product, if any, to prevent or help with the oily skin?
Okay, that's a good question. And I get that a lot. I think, oily skin is just, your skin overproduces, the oil. There are products that will help to kind of like reduce the production of oil, and that just kind of give you that matte complexion. So you're not just, shining before you get out of the house. But I don't think there's anything specifically to treat that 100%. It may help, reduce, and especially if you use oil-free products, it will just help to reduce, or just you're not as shiny, or but it's not, I don't think there's anything out there. If I'm I could be wrong, I stand corrected if I'm wrong. I haven't seen anything out there that I can put in my face. I do also have slightly oily skin, but I haven't seen anything out there that I can just put on my face and then it will just prevent oil production. Some people will produce more than others. It's just like some people sweat more than others. So it's
Yeah, somebody's saying powder will work, but I can tell you this is a true story. I've seen 3 or 4 people putting milk of magnesia on their face, and they put the makeup on top of it, and it actually do work. Whether it's recommended or not, have you heard anything about that?
Milk of magnesia, yes, I've heard about it. That is the worst thing to put in your face. Yes.
Yeah.
It will do it. I've never used it, and I would tell anybody out here that's using that, just stop. Go get a primer and use it for your face. Don't be cheap. Some people use it because
I'm laughing so hard because I know several people that I know, they have actually used this product for a long time. So go ahead.
Yeah, just stop being so cheap and go get the real thing. Yes, it will give you matte complexion. When you're putting your makeup, you'll just be really smooth, but it messes up with your skin. You use it over time. It's not something you want to use over time. Maybe, okay, once in a while you can use it, but that milk of magnesia was made for a reason. It was not made for that purpose. Talk to a skincare professional can recommend something for you.
Yes. So I think we're coming to the end of this broadcast. This was like really fun show. So can you give us your website? We can look some of these products, or even your website, your own website. Do you have any?
Okay, yes. It's www.rhodaojwang. I will put it on here at the end of this broadcast. Rhoda Ojwang at rnf.com or something like that. I don't even know my own website. Yeah, but I will put it on this broadcast when you are done. So again, when you go into the website, just click around and call me for a consultation. It is free, you guys. Please don't just start ordering stuff and then you start to write to me and say, this did not work for me. My face is broken out. Please talk to me and I will advise you accordingly because I am the expert.
So, but just to clarify, you say you don't have any inventory. So you just a consultant, you recommend and they can go get it maybe from whatever they want to go get it. Is that right?
No, not whatever. We speak, I give you consultation, and then you go and order from my website. Because if you're going to order from someone else, I just did zero work.
Exactly.
Yes, so I give you a consultation. You
That's why it's a consultant. Yeah. Right. Yes.
Yes.
Yeah. So that's good. Do you want to read some of the comments there? Because you're the boss here. So if you want to pick up maybe 2 or 3 comments, you can read and maybe you can answer some of those.
Okay.
Yeah.
I see Marie Dole, all the way from San Francisco. What's up, girl? It works. This is a very loyal customer of mine, and she uses the anti-aging. Sorry, Nimeanika, what you use, but it works for her. No free lunch in America. Yes, Sam Kambui. Like, why would I give you a consultation and you go and order from another person's website? They can do their consultation over there and you order from...
No free lunch. Yeah.
Naiva Jamali. Hey, Naiva. How are you? I hope you're doing fine. Zile comments zingine Joji zimeenda huko juu. Sorry.
Oh, okay.
Mom has removed depression. Okay. Someone is saying, is she talking about MOM has removed depression? I'm not sure. Susan,
what is mom or MOM? What is MOM?
Milk of magnesia.
Oh. Duh.
It says milk of magnesia has removed depression. I don't know. What do you mean? Like, has it helped your face and now you're not depressed anymore? But from what I know, it does not treat anything in your face. It just kind of helps to, I guess they give you that.
GI, it's a GI product, yeah.
Yeah, it's a GI product. So I don't know the what's the correlation? The GI and the depression, like maybe I'm missing something. Maybe I missed
0.
your comment previously. Let me just go down. I missed a lot of questions, Georgie. Maybe you were looking at the chat box more than I was looking. I don't know, but yeah, you guys, these products are good. And we do have a 60-day money-back guarantee, Georgie. So if you decide 60 days, I didn't get the results I wanted with these products, then you can just pack it up and send it back and get your money back. That's how much, we believe in this product. So which other company?
Do you have any male products?
Huh?
I don't mind anti-aging. Yeah.
Okay. You know what?
Yeah.
Men have skin too. So for you, you can use, your skin looks good. I don't see any acne. Do you have makeup on?
No, I don't. Just a little bit fair and lovely here and there once in a while, but no, I don't.
You can use the anti-aging one. And it's also for men. I know men don't like to take care of their skin because they think it's a women's thing. And let me say something else.
Yeah.
Anybody 25 years old and above can use anti-aging skincare products because that's the age when your skin starts to change. So don't wait for that line or wrinkle. They say the best wrinkle is the one you never see. So if you start using products early, then you are using it, you're preventing. And then when you use it, when you start seeing the deep lines and the wrinkles, then at that point you are treating. So prevention is better than cure, you guys. An ounce of prevention is worth a pound of cure. And in skincare, we say an ounce of prevention is worth a pound of fillers. Thank you, guys.
Alrighty. Thank you so much. I really enjoyed this broadcast. So tomorrow, I'm going to bring Eunice Menja. She's a life coach. I brought her about maybe 3 weeks ago. We're going to be talking about cyberbullying, the eradication of the teenage suicide. This conversation has to keep going. We're still going to talk about it. So thank you so much, guys, for watching these broadcasts. And I want to thank you, Dr. Rhoda Ojwang. It was really nice, and hope we're going to have this conversation in future. All right? Keep it right here. Thank you.
All right. Thank you.
All righty.
Bye.
Bye.